So there are a number of different types of surgery we do for epilepsy. It really depends on where the seizures seem to be coming from. The greatest experience and the most well-documented results are for a type of epilepsy called mesial temporal epilepsy. And that surgery involves essentially removing those structures or part of those structures. And that type of surgery can be tailored depending on which side of the head the seizures seem to be coming from, what the risks are of surgery, and where exactly the seizures are coming from. And we have really good evidence that surgery is the way to go. And I showed you before that the likelihood of having good seizure control with medication is very poor if you've failed 2 medications. There was a trial done that was published in the New England Journal in 2001 that really highlights that surgery is superior to continued ineffective medical therapy. This was done in Ontario in a group where they had a waiting list for patients for surgery. And patients were either fast-tracked to surgery or they remained on the waiting list as a comparison group. They only had the capability to offer so many surgeries a year. And what they found, in spite of really good medical care from expert epileptologists, were that the likelihood of having reduction in seizures to the point that there are no longer seizures with impaired awareness was about 60% in the surgical group with a standard temporal lobectomy and 8% in the medical group. Now, people can still have some seizures, and patients often need to remain on their seizure medications after surgery. You can see on the graph on the right that for being completely seizure-free, without an aura, without a seizure that doesn't impair consciousness, the likelihood of cure is only about 40%. And in this group too, there's significant improvement of quality of life. Now, surgery is obviously really scary, and it's a significant risk, and we have all seen the risks, and we've all had results that aren't great, but the reality is that the risks of continued ineffective medical therapy are worse. So even in this short trial that was only 1 year, the only death in the trial was a patient in the medical group who died from SUDEP. So the risk of depression was very similar. There were some risks of surgery, no question about it, but in general the risks were lower. And in a systematic review of the literature, looking at multiple different trials, multiple different series from a number of different surgical centers, in general, the risk of death from epilepsy surgery is less than 1%. And the risk of having a significant neurologic deficit, weakness on one side, problems with thinking, problems with memory, or increased problems with memory is about 3%. And as a result of this work, this group from Columbia University in New York published this study from 2008, and sort of, if you take a patient and you account for all the potential complications of surgery and the risks of complications with continued ineffective medical therapy, what you find is if you take the average 35-year-old with temporal lobe epilepsy and you offer them surgery, even when you account for all the complications, you've added 8 years onto that person's life. And this figure is from the group at Queen's Square at London, and this shows that we're not just looking at 1 year. When you look at 10 years, you really still have a really significant percentage of patients that are completely seizure-free. So in their group, it was about 55% for temporal lobe epilepsy. So this has been a subject of a lot of interest from the medical community and even from the federal government. The Institute of Medicine produced this report in 2012 that estimated that there are about 1 million Americans with drug-resistant epilepsy in the United States. And of those, we think that about 100 to 200,000 are surgical candidates. And yet, we know that there are only about 4,000 surgeries for epilepsy performed in the US. So that means that we're missing the boat on, probably 90,000 patients, if not more. And this has been known for some time. The American Academy of Neurology said in 2003 that epilepsy surgery is underutilized. And there is some evidence that the longer you wait, the less likely the patient is to be cured. That continued seizures for years and years cause changes in the brain that make the patient much less likely to have a good result. And when we look at the large surgical series, in general, patients have had epilepsy for 22 years and more than 10 years after having failed 2 seizure medications. And to me, this is really just unacceptable.